Hello, I'm Joan Gluch. I'm a faculty member in the Division of Community Oral Health at the University of Pennsylvania School of Dental Medicine. That's such a good question because water fluoridation is a key part of community actions that are accessible to everyone to prevent cavities and promote good oral health. When a small amount of fluoride is added to the drinking water, research shows that community members have at least 25% cavity reduction just from drinking the water. Easy access is especially important for those who are not able to visit the dentist or buy fluoride toothpaste or really access all the dental activities needed to prevent cavities. The public health benefits for water fluoridation are strong, especially since we have close to 80 years of experience and cavity reduction in United States cities that adjust their fluoride in the drinking water. By just adding a small amount of fluoride, we know we have less cavities in both children and adults. But do you know the number of individuals who are wearing dentures is at an all-time low in the United States? We've been able to help individuals keep their teeth longer because of the health benefits of water fluoridation. Now, it's interesting you brought up individual choice because since fluoride is a naturally occurring mineral and readily available in rivers and foods such as grapes and tea, virtually everybody's exposed to some level of fluoride. Although our society respects individual rights, we weigh them carefully when there's a benefit for the common good because they benefit public health and safety. Think of seatbelts, how valuable seatbelts have been to reduce trauma from car accidents and save lives. That's an example where we, in terms of public health, weigh both individual rights and population rights. I wanted to emphasize that fluoride's a natural mineral and it's not a medication when we look at how it's added to the water. Water with added fluoride is kind of similar to adding iodine to salt or vitamin D to milk. I mean, we add chlorine to water. So we're looking at safe, effective products and not forcing people to take medications. For every dollar spent on fluoridating the water, $20 is saved in dental care. That's a real benefit when we think of the very small amount of fluoride that's put into the water. The Environmental Protection Agency tightly regulates fluoride in the water at zero point 0.7 parts per million. This is much less than the studies that showed any potential cognitive effects. For example, the studies conducted in Mexico and Canada had much higher levels, for example, 2.5 parts per million, 5 parts per million in those communities that they were studying. Now, another point is it's very challenging to study cognitive abilities, especially in children. So, the most recent study that we saw come out of Mexico, they were looking at children aged 3 and 4. And many of you who have families, experiences with young children, know how difficult it is to assess and communicate cognitive ability with a 3 and 4-year-old. So the ideas of standardized tests that are validated, that are continued and used, those are important ways to evaluate studies. And simply stated, the studies that show the associations, again, it's not causation, but any associations just haven't held up to the scrutiny of the high scientific standards we expect. You know, we make decisions based on the evidence so that our clinical care has to be guided by the best research studies. And the studies that show any potential cognitive effects just don't meet those high standards. The United States has a long history of funding safe, effective municipal water systems. That's not been the case in many countries, and a number of countries use either salt fluoridation, where fluoride is added to salt, like we add iodine to salt, or also milk. Um, the other issue is other countries promote free or low cost and easily accessible dental care, especially to children, but also throughout the spectrum. Other countries also promote more nutritious meals. So, with a combination of readily accessible dental care, um, healthier and nutritious meals, there are different approaches that other countries take rather than fluoridating the water. There's an interesting example from Canada because in 2011, Calgary banned water fluoridation. And in 5 years, cavities among elementary school children increased almost twofold. Calgary ended up putting back fluoride in the water in 2021, and we don't have any recent studies yet to show how dental decay has declined. But I think it's important to understand that taking away a proven measure to prevent dental decay is going to have consequences in communities, especially those who may lack access to dental care, may not have enough dentists, especially to provide care to low income individuals. Oh, as public health scientists, we are constantly monitoring the health of the public. And we have 80 years of strong, safe, effective fluoride backed up not only by experience, but also by the scientific research. Over 1,000 studies document the safety and effectiveness. It's rather bargain. It's 50 cents per person per year that cities that it costs to fluoridate. And for every dollar spent on fluoride, $20 are saved in dental care. So we have a very practical experience base with a tried and true preventive measure that has strong scientific evidence at the recommended levels. And again, I'm talking about very small amounts, zero point 0.7 parts per million. That makes such a difference in less cavities and better oral health for everyone in our communities.